So, my research is on lack of access to high quality, affordable health insurance in the United States. So, health insurance is typically covered by either your job or you pay into your health insurance or you are covered under the government, so Medicaid or Medicare. Um, so, there's millions of Americans, including qualifying low income families, teenagers, pregnant women, elderly adults, and people with disabilities that are covered with health care by Medicaid or Medicare. As of June of 2020, there were 67 million people, individuals that were enrolled in Medicare and Medicaid in 51 states. And then there was 56 million individuals currently on Medicare. So, the prevalence of health insurance broken down by relevant demographic groups. So, it was reported in 2018 that 1 in 5 uninsured adults went without needed medical care due to cost. Um, in 2018, 45% of uninsured adults said that because the cost of health insurance coverage was too high, they stayed uninsured. So, NKU's response to the social problem of lack of access to high quality, affordable health insurance. Um, so, is NKU currently addressing the lack of access to high quality, affordable health insurance? So, NKU does not currently provide health insurance for students. However, if you are a student that is um, over like that isn't from the United States, it is by law that that NKU has to provide health insurance to those students. So that's the only way that you can get health insurance through NKU is if you're not from the United States. Um, However, there is the health counseling and student uh, wellness center, which is on NKU's campus, and you can go and get you can make like a doctor's appointment there. However, they do not accept Medicaid, which I thought was interesting when I was doing my research through this. Um, However, if you are covered under like your parents' insurance or if you have insurance through your job, you're more likely to have you can use that insurance through NKU's to get like medical needs met on NKU's campus. Um, so the Health and Counseling and Student Wellness Center is located at University Center 440 on NKU's campus. Even though NKU does not provide health insurance to students, they do provide primary health care services to NKU students. So that's where you can like use your, like if you have your own health insurance card or if you have health insurance through your parents, then you can more likely than not use your health insurance and get, seek care through them. If a lot of people don't have primary care physicians, so if you needed to see the doctor or whatever, or a nurse practitioner, NKU can provide that for you. But like I said, they don't accept Medicaid or Medicare. Um, they do, however, have on their website um, ways for you to get in touch with Kentucky and Ohio's Medicaid services for you to fill out the forms in order to get health care in those states. And here are some resources that I found. Um, like I said, you can get on the Kentucky's website for Medicaid, and also Ohio's. Um, they both, it's pretty self-explanatory. Like in order to get on and like fill everything out, it's pretty lengthy, but if you have questions, most of the time they have people that can help you help you fill it out. Um, so my literature review was the impact of poor health insurance on children and families. So poor health insurance can have a negative impact on children and families. Specifically, it can negatively affect their mental health, physical health, and financial well-being. So, with their mental health, even though laws were put in place back in 2008 to cover mental health treatment by health insurance companies, it has been reported that insurance companies still interpret mental health claims more stringently than physical illness. It was reported that people with a mental illness are more likely to have low incomes and not have any health insurance. So the physical health. The health status of the U.S. population depends especially on those at greater risk of different health conditions and those with special needs for health care, which both disproportionately impact disadvantaged children and families, and on their availability and accessibility to reliable and high quality health care. 1 out of 4 people are not taking care of their own health and often losing their lives by ignoring that they need medical treatment due to the cost, as health insurance costs per person is twice the household income rate. So, financial well being. Families often must choose between basic needs and healthcare needs. Many families are faced with making the choice to buy medication instead of food or vice versa. Right now, I'm doing my field placement in the hospital, and I even dealing with like my grandparents who I see how much their medication has been, and I definitely can see how that is. A lot of times medication is some of it's covered by Medicare, but it's still like $60, and they need it every month. And if they're just living off of Social Security, that's just a lot of money for people that are living on a fixed income. So it's really sad that they have to make those those choices, which could is a life or death situation a lot of times. So my research question is, to what extent does the cost of healthcare contribute to feelings of stress? And my other one was, to what extent have people postponed or avoided seeking health services due to the cost of healthcare? So my variable um, for this is feelings of stress due to cost of healthcare and avoid seeking healthcare due to cost. So my survey items that measure my variables are feelings of stress due to cost of healthcare. So how often have you experienced stress due to healthcare? So I said never, almost never, sometimes fairly often, and very often. My other survey item to measure was avoided seeking healthcare due to high cost. So my question is, in the past year, how often did you avoid seeking healthcare services due to high cost? So the demographic survey items that I wanted to include on our group survey were race and ethnicity, male or female, and what insurance plan do you currently have? So Medicaid, Medicare, private insurance, or no health insurance. So my research methodology. So basically is the survey consists of two questions which measure the following constructs: experience stress due to healthcare costs and how often you avoid seeking healthcare services due to high costs. And the survey also contains two demographic questions inquiring about participants' gender and location. And here is our link for our group survey. And here are all of my references. Thank you.